So in ocular trajectory system also nanotechnology, liposome, neosomes system will be there. So what is nanoparticle? The size range is nano size means that is nanoparticle. So here 10 to 1000 nanometer will be there, and we can prepare a nanosphere and nanocapsule both. So particulate systems in a nanoparticle drug. So topical system we can use a chloramphenicol. Local injections we can use of 5-FU means fluorouracil we can use. So polymers used are biodegradable. So example is polyalkyl acrylates. So this is mainly we can use it for cancer therapy also, and also ocular cancer therapy. When we can use means when we are targeting to the optical nerve, so thereby it will reach to the brain. Okay, so like that we can target, and also for a systemic purpose of ocular diseases or any ocular therapy if you want to do, so you can use this system. What are the advantages? Sustained drug release we can achieve, site-specific target we can achieve, higher cellular permeability, protect the drug from hydrolysis, efficient crossing membrane barrier we can get, act as an inert carrier for ophthalmic drug. So preparation of nanoparticle, that is no need, I hope. Okay. But if you want one, I'll explain. So we are taking polymer which is biodegradable and drug, and that drug we are going to dissolve in organic solvents like carbon tetrachloride, benzene, or in which it will be going to dissolve. Okay, so that we are going to mix with the polymer, and that we are going for the sampling rotations. So many rotating filter will be coming, so rotating drum will be coming. So with that help, so we are going for the rotations. Okay, so handshaking method or the different extrusion method will be there. So with the help of that we can use here the solvent evaporation method they explain. So what are you doing? So we are taking polymer, drug and the solvent. So keep it for evaporation, okay, at one particular temperature. So whatever the organic solvent will be there, right, so that will get evaporate completely, leaving behind polymer and drug, which is drug is loaded in polymers. Okay, so here we are going to add in the aqueous phase to get stabilize that system. So then the complete evaporation of the organic solvent we are doing, and that we are going for the filtration, and then we can go for the drying, and thereafter we are getting the nanoparticles. Okay, so here the in everything, so we can use a solvent evaporation like liposome, neosomes, microsphere. Solvent evaporation method is a very, very important. So in your next year you are going to prepare this method. So biodegradation of the drug release. Polyalkyl cyanochralates are rapidly biodegradable. Esteresis cause breakdown into soluble polymeric acid. Slow degradation in absence of esteresis will occur. So one of the main question, that is ocular inserts. They will ask or give example for ocular insert. Write a note on ocular insert. It's a sterile preparation with a thin multi-layered drug impregnated solid or semi-solid consistency devices placed into Cull-Day sac or conjunctival sac cavity. Okay, what are the advantages? Increases the contact time, and thereby we can get a good bioavailability, providing prolonged action, reduction of systemic side effect, adverse effect also we can reduce, reduction of the number of administration, frequency of administration is not there here. So desired criteria is ease of handling and insertion. Ocular insert, best example is mini disc and contact lens, what we are seeing, right? So that is also example for ocular insert. Okay, lack of expulsions during wear, reproducibility of release kinetics is high, applicability to variety of drug should be in a proper way, non-interference with the vision and oxygen permeability, sterile it should be, ease of manufacture. So to the classification of ocular inserts, insoluble inserts will be there, which is not soluble. So when you are going to administer, so after complete drug release, that insert device we have to take it out. Okay, and bioerodible inserts will be there. Bioerodible means it will degrade inside our eyes only. Soluble inserts also there, so that is also degrade here in our eyes only. Insoluble inserts example is accusert. Okay, so mainly they will ask diffusion accusert. Osmotic based soft contact lenses. Osmotic based accusert will be there. Soft contact lenses are becoming. Biodegradable insert example is lacquer and mini disc. Soluble insert like XOD. Okay. So they will ask classification for ocular inserts, write a note on mini disc, write a note on lacquer, SOD or contact lens or occlusert. So like that they will ask. Okay, important thing here. So insoluble inserts. The first one is diffusion insert or occlusert. So central reservoir of drug enclosure. So here you can see. So this is what the reservoir. Okay, the complete occlusert it is. So it's a central reservoir of a drug enclosed in a semi-permeable or microporous membrane for diffusion of a drug. Okay. So diffusion is controlled by the lacrimal fluid penetrating fluid. The release zone is follows zero order kinetics. So this is a opaque white for visibility in handling and inserting system. Okay. So we had to touch this one and we had to insert this one by handling this opaque one. And this is a transparent rate controlling membrane. So it is polymeric membrane this is, and this is a pilocarpine reservoir. So this ring it containing a pilocarpine, nothing but drug reservoir. So this is only ring which is this pilocarpine reservoir is going to attach in the central position, and downside and the upper side we are having a rate controlling membrane. So through this rate controlling membrane the pilocarpine will be releasing, and this ring is to hold this circular devices. Example is occlusert 20 to 40 microgram per hour for 7 days. Annular ring impregnated within titanium oxide, so titanium dioxide for visibility we are going to use it. So it is osmotic insert. So this is surrounded by a central part is surrounded by a peripheral part. Central part single reservoir or two distinct compartments will be there. Peripheral part is a insoluble semi-permeable polymer. The tear fluid diffuses and induces dissolution. Solubilizer deposits generate a hydrostatic pressure. Drug is then released through this aperture. So it is almost like occlusert only, but here we are having only one compartment of drug, right? So they may contain two compartments, and it is having a two semi-permeable membrane. Okay, so that will be acting through the osmosis process. Okay. Contact lens, pre-soaked one, hydrophilic lens. Drug release within first 1 to 30 minutes. Alternate approach is also there. Incorporate drug either as solution or suspension form. Example is pilocarpine. So release rate is up to 180 hours. So next is a soluble insert, that is what SOD, soluble ocular drug insert. Small water soluble made of soluble synthetic polymers. Composition is acrylamide, vinyl pyrrolidone, ethyl chrolate we are going to use in. Weight of that soda is 15 to 16 mg. So in 10 to 15 seconds it will soften, and within next 10 to 15 minutes it will turn into viscous fluid. So after 30 to 60 minutes it will becomes polymeric solution to release the drug. What is the advantage of SOD? So replaces 4 to 12 eye drops installations or 3 to 6 application of ointments, once a day treatment of glaucoma. So next is the corneal collagen sheet. So disposable sheet it is. Short-term therapeutic bandages, bandage lens for the cornea. It confirms the shape of the eye, it's normally similar to the shape of the eye, protect the corneal surface and provide lubrication as it dissolves. The shields are derived from bovine collagen and are 14.5 mm in diameter, sterilized by gamma irradiation. So disadvantage is not optically clear, so some vision problem they may cause. Okay, and the collagen shield causes some discomfort also. Clinical uses wound healing, treatment for dry eye we can use. The last is lacquer and mini disc, biodegradable insert. Rod shaped device, lacquer is a sterile one. HPC is the main polymer we are using. Hydroxypropyl cellulose. Weight is a 5 mg, very small one it is. Dimension is diameter is 12.5 mm and length is 3.5 mm. So for dry eye treatment we are using this lacquer rod shaped device. Remember it. Mini disc is a counted disc with the convex front and concave back. So mainly we are contacting with the eyeball. 4 to 5 mm in diameter. Silicone based polymer we are going to using here, and the drug release up to 170 mg, we can up to 170 hour we can take. And liposomes, that will be there. So just read one. The same thing. So what is liposomes? That you have to write vesicle composed phospholipid bilayer enclosing aqueous compartment in alternative fashion. So same thing you can write down. So liposomes, advantages and disadvantages. So this is about controlled drug delivery system. In the next video we will discuss rectal and transdermal.